All right, good evening, everyone. Nice to see you all. I trust you all had a blessed day. And tonight we're going to just have a conversation here about cancer. Cancer is the third leading cause of death in Fiji. And so we need to learn something about cancer and how to hopefully avoid it. Before we get started, we'll open up with a word of prayer. Let's pray. Father in heaven, we thank you for this time and thank you for this privilege of presenting this topic of cancer. You desire for us to be in good health and to prosper in good health, even as our soul prospers. We know that cancer is a terrible thing, but Lord, you have promised to heal us and to keep all these diseases from us, if only we would follow your divine plan. So I pray that you would be with us now and prepare our hearts to hear from you. In Jesus' name, amen. All right, so again, the topic is cancer. And so what is cancer? What is cancer? So according to the National Cancer Institute, and that's in the U.S., cancer is a disease in which some of the body's cells grow uncontrollably, right? Uncontrollably and spread to other parts of the body. I'm sure if I ask for a show of hands of how many of us have been affected by cancer, either personally or family member or friend, somebody we know, all of our hands will go up. Okay? Now, cancer could start anywhere in the human body. Okay? And so, normally the cells would, our cells are made in such a way that after a period of time when they grow old or damaged, they will just die away and the body will replace them. And that's the normal way of things. But sometimes cells grow uncontrollably and they refuse to die. They refuse to die. Something happens in our bodies that cause cancer cells to develop and to spread uncontrollably. Now, sometimes when tumors form, sometimes the tumors could be cancer tumors or they could be non-cancerous. We call those benign tumors. But benign tumors do not mean that they are not dangerous. Okay, sometimes benign tumors could be very dangerous and deadly. If you have a benign tumor in your brain, depending on the area and other factors, it could actually cause death if it is not removed. So we know that a non-cancerous cell could also be deadly. And cancer cells are known to evade the immune system many times. So the immune system is not able to always attack the cancer cells. Okay? And these are just some of the agents. This list is not exhaustive, but these are some of the common cancer-causing agents. And you could look at them and tobacco, alcohol, excess fat, dietary fat, right? Viruses, eggs, milk, cheese, saturated fats, environmental toxins, meat and all the other meat products, excess sun exposure. Now, over here in Fiji, you have a lot of sun, okay? Now, the darker your skin, the more you are able to tolerate the sun without any problem. Because my skin is dark, I could be in the sun. I have never used sunscreen, right, in my life. I grew up a bit in Africa and then in the U.S., sometime in Europe. I've never used sunscreen on my skin. But now the lighter your complexion, the more prone you are. So you want to be in the sun, but you want to minimize your exposure if you have very light skin. Okay, you want to minimize your exposure. But darker skinned people, it's not too much of an issue for us. But you could still get skin cancer, by the way. Of course, we see the other factors there. Okay? And these are some of the warning signs. And again, the list is not exhaustive, but these are some of the common things you would experience if you have, if there is something going on like this. You want to be sure to go to the doctor to go get yourself checked. If you have some trouble with, just a change in your bowel or bladder habits, okay, sometimes it could be nothing, but it is always a good thing to go get it checked. If you have a sore or a wound that doesn't heal, okay, unusual bleeding or discharge, a nagging cough or hoarseness, coughing up blood, okay, unexplained headache or pain in the head, excessive bruising, excessive itching all over the place. So we sometimes thickening in the skin. So as you see here, there are many factors, and there are even more factors which we don't have on the list today. So something that looks unusual, that is concerning, you want to get it checked with your doctor. Okay, now cancer screening varies from country to country. Some countries have a more robust cancer screening protocol, and some countries have not as robust cancer screening protocol. Now, Fiji, according to my research, does not seem to have a very robust cancer screening protocol. Unlike New Zealand and the United States and so many other parts of the world, where we have a more robust screening protocol. But whatever you have, take advantage of it. Okay? For example, for breast cancer screening, okay, mammograms, take advantage of that. Okay? Colonoscopy or sigmoidoscopy or stool test, whatever you have, take advantage of it. Talk to your doctor. If you meet the age criteria and you have the screening, then go ahead and do it. Don't think that you are, sometimes people think they don't have to do these tests. I have a cousin who lost her husband about 9 years ago from colon cancer because he did not think that he needed to do his colon cancer screening. I tried to tell him, but he did not listen. And next thing you know, he had colon cancer, and within 2 years, he was dead. So please find out what you have as far as your screening protocol and do the screenings according to your age. Okay? And if you have family members, also encourage them. If you have family members who smoke, who drink alcohol, encourage them to give these things up. Pray for them, and help them to get the screenings that they need. Okay, so cancer again is the third leading cause of death in Fiji. And the number of new cancer cases in Fiji is increasing. It's becoming a problem. And of course, with women, breast cancer is number one, the most common and the deadliest, and of course, cervical cancer also. In fact, I have already met some patients here at my hub who have dealt with these types of cancers, but thankfully, they are doing well. And so the most common cancers in Fiji are lung cancer, liver cancer, stomach cancer, colon cancer, prostate cancer. Now, you could still get lung cancer even if you don't smoke. There are different types of lung cancer. So if you're coughing up blood or something is not right, go get it checked out. Now, for men, prostate cancer is the most common. Even in America, for men, it's a very common cancer. And it could be, it could be addressed and it could be cured if caught in time and addressed properly. It doesn't have to be necessarily a deadly cancer, but it could be if not addressed appropriately. So what we eat matters. What we eat matters. The studies show that, for example, when they put breast cancer cells in petri dishes, okay, and they dropped the blood of the standard American diet, people who eat the standard American diet, okay, when they dropped the blood of those people on cancer cells, very few cancer cells die. But when they dropped the blood of people who ate a whole food plant-based diet on the cancer cells, most of the cancer cells died. And that's why we are here to encourage you to get on a whole food, plant-based diet. Some of the things that we understand, again, this is not exhaustive, but some of the common things that we know that people eat a lot here in Fiji and America as well, and many parts of the world, something called methionine. Okay, methionine is an essential amino acid. That means your body needs it, but it doesn't make it. Okay? And methionine is very high in foods like fish and chicken. I know that many Fijians tell me that they only eat fish. Well, surprise, surprise, fish is not a healthy source of meat. It's not a good source for protein. Your plants, you're eating your legumes, that's a much better source of protein. So fish and chicken have the highest amounts of methionine before you even get to meat and dairy and eggs. A low methionine diet is actually able to starve cancer cells. So you need methionine, but you don't need it very high. And of course, one of our doctors who does a lot of research in America on lifestyle, he said that when you eat lower methionine foods like fruits and nuts and veggies and beans, these are the best foods to reduce your methionine levels and prevent this deadly disease of cancer, hopefully. Now, another one is arachidonic acid. Arachidonic acid is known for its inflammatory behavior. So cancer thrives when you have a lot of inflammation in your body, cancer cells thrive because your body is very acidic. And cancer thrives in an inflammatory, acidic environment. So you want to eat a whole food plant-based diet because that would reduce the inflammation and acidity in your body. Okay, so many of the omega-6 fatty acid foods, especially the oils like corn oil, safflower oil, cottonseed oils, they're very high in omega-6 rich acids. And omega-6 rich acids, you don't need a lot of it. If you have high amounts because of your diet, it is dangerous. It is dangerous for your heart and dangerous for cancer. Okay? You want to eat more and have more of omega-3 fatty acids, like you get it from nuts, seeds, those type of things. And guess what? Chicken and eggs have been shown to have the highest arachidonic acid. And very, very inflammatory. And in fact, studies show that prostate cancer is worsened by up to 200% in the Petri dish when people have a high arachidonic acid level. So again, avoiding these foods, chicken, eggs. I know many people tell me here in Fiji, they eat eggs every day. Not good, not good, because you increase your risk. And of course, we know that meat is a big cause of cancer. Okay, the WHO have reported that processed meat is carcinogenic in humans. In other words, processed meat has been found to cause or to promote cancer in humans. And non-processed meat and red meat are probably carcinogenic, okay? But that means that it's leaning more to being carcinogenic than not. So you want to avoid all meat products as much as possible because they are all carcinogenic. Now, of course, processed meat has been linked directly to developing colon cancer. So you want to avoid even the processed meats. We have talked about avoiding processed foods so many times here since we've been here, so you want to avoid them as much as possible. And something else called nitrites. Okay, nitrites are found in high amounts in processed than unprocessed meats. Again, processed foods, processed meats, dangerous. Okay, more than the unprocessed. And sodium nitrite is found to be a culprit in many studies for cancer promotion. Okay? So you want to avoid foods that are high in nitrites, such as animal products, such as meat. Because in meat, okay, when you eat meat, okay, the nitrites in meat, they convert to something called nitrosamines. And nitrosamines have been found to promote cancer when you eat them. So again, you want to avoid meat products because you want to avoid. In fact, the nitrites over in America, I don't know about Fiji, but over in America, they treat the meat with nitrites so as to preserve the meat, and it gives it a good flavor and it gives it color. So you see it looks so nice and red and inviting, but no, it's dangerous for you. How about plants? Plants also have, nitrates, right? Plants also have nitrates, which are converted into nitrites when consumed. But the difference with plants is, instead of being converted to the nitrosamines, they are converted to nitric oxide. And your body, your heart just loves nitric oxide. You might know that if you're having a heart attack and they call the ambulance, okay, the first thing they give you is nitroglycerin because it helps to dilate the blood vessels. Okay? So your body likes to get nitric oxide, but it doesn't like to get nitrosamines because that one causes cancer. Okay? And so another thing that we talk about here is insulin growth factor 1. Now I don't know that Fiji injects their cows and their cattle with the hormone RBST. That hormone stands for recombinant bovine somatotrypsin. Now in America we use that hormone to inject cows so they could get big faster and produce more milk. But it is dangerous because it's cancer producing and cancer forming. Now in Europe they have a ban on that. Europe doesn't use it. There is a ban. But I don't know if Fiji uses it, but if they do, it's dangerous for you. So you want to avoid it. And even in the milk of the cow, it's also very dangerous. It goes into the milk. Okay? And so eating plant protein will decrease your levels of insulin growth hormone factor 1. You need IGF-1 when you're growing up, like the little children here. They need IGF-1. But when you're an adult, you don't really need, you need only a little bit of IGF-1. If you have too much, that could promote cancer development. And eating things like soybeans, right? Soy, okay? Things that contain soy is helpful in preventing or reducing the binding of IGF-1 to the receptors. And so your risk then is reduced. So eat up with your legumes, your tofu. Eat up and enjoy it rather than eating the animal products. Now, here is a breast cancer which is very common in Fiji. Okay. Now, women produce testosterone, okay, but not as much as men. Men produce estrogen, but not as much as women, right? But we all produce these hormones, okay? Now, the heavier you are, the more fat tissue that you have, the more you have a problem because the more this reaction takes place. In the cell, in the fatty tissue, testosterone is converted to estrogen by the action of the enzyme aromatase. Okay, that's the enzyme. So the more fatty tissue you have, the more this takes place, and the more your risk for breast cancer increases. Okay, and by the way, it also happens for prostate cancer. Okay, so you want to try to lose the weight, and we encourage you guys, by a whole food plant-based diet, you would reduce the weight. By having 2 meals instead of 3 meals a day, you would reduce the weight. Now, the way to prevent this process from happening is eating mushrooms. Okay? Mushrooms will stop the action of aromatase. Do you have mushrooms in Fiji? Do you have mushrooms here? You do? Okay. So it doesn't matter You don't have to buy the expensive one. You could buy any mushroom that is edible, okay, in the market. Or if, as long as you know it's edible, mushrooms are able to stop this process from happening because mushrooms act on aromatase to prevent it from converting testosterone to estrogen. Okay? But mushrooms is better off cooked because when you eat it raw, it contains a chemical called agaritin, and that could cause some other problems for you. So you're better off cooking your mushrooms, even if you just saute. Okay? And then something also called heme or non-heme iron. Now sometimes people say, well, my doctor told me to eat red meat because I have anemia. Okay? Now you could get iron from plants. The dark green leafy vegetables give you good source of iron. It's a good source of iron over meat. Because meat, when you eat meat, you get what we call heme iron. And heme iron is absorbed very readily in the human body, and it could cause cancer and other problems. But when you eat non-heme iron, which you get from plants, from dark green leafy vegetables, it helps the anemia, but it also is not very readily absorbed. The body only takes what it needs, and so your risk for cancer and other problems is reduced. So again, yay for plants. Okay? And then saturated fat. Saturated fat, the most common source, okay, and the highest source of saturated fat in the United States and in most parts of the world is cheese. How many of you love cheese? Me too. But guess what? Because God wants to give me good health, I stopped eating cheese. Because cheese is very dangerous for us. When you eat a lot of saturated fat, okay, your risk for cancer and inflammation increases. And the highest source of cholesterol is eggs. How many of you love eggs? All right, well, now you know. So you stay away from the eggs, you stay away from the cheese, and you reduce your risk of inflammation and high fat and high cholesterol, and your risk of cancer decreases considerably. And heart disease also, and diabetes and all of that. So now here is this diagram here. The cancer cell, if you see that little cell up there, it looks very lonely. It looks very lonely. It needs a blood supply, otherwise it will die. Cancer cells are able to send out messages to the blood supply so that the blood supply will send out branches to the cancer cells to give it blood. Once the cancer cells get the blood supply, it goes totally out of control. It goes crazy. As you could see there, the last diagram there, the last picture, it is completely uncontrolled. You can't stop it. It's very, very, it just goes buck wild. It spreads all over the body, and you have cancer and metastasis, and it goes out of control, and now you're at a risk for dying. But when you eat a whole food plant-based diet, that could stop that process from developing. Yeah, for whole food plant-based diet? Yeah? So again, whole food plant-based diet has so many benefits. I mean, everything that you want to happen for your body to serve God better happens with a whole food plant-based diet. You have good health, you have energy, you have less risk for disease, and you could be of benefit to the service of God. And so, what is a whole food plant-based diet? Well, we've been talking about it every day, and we're going to hear about it even more and more and more until we live in. You're going to hear about whole food plant-based diet so much that you're going to be dreaming a whole food plant-based diet. You're going to be dreaming these pictures when you go to bed at night. That's all you're going to dream. And it looks so beautiful, right? You just want to get your hands on that thing. And so from now on moving forward, you want to be in this. That's what you want to be eating on a regular basis. And so the top 6 anti-estrogen foods. Again, estrogen promotes breast cancer. Okay? And so you want to cut down on your production of estrogen. You want to lose the weight. Okay? And the foods that promote anti-estrogen buildup are soy, mushrooms, cruciferous veggies like broccoli, cauliflower, kale, all these ones, citrus fruits, ground flax, and fiber. And by the way, ground flax also, because if you have too much testosterone, like us, like men like us, okay, the risk for prostate cancer increases. Okay, but ground flax has been shown to reduce that and to potentially prevent prostate cancer in men. So when you go to the market, get some ground flax, sprinkle it on your food, put it in your smoothie, and eat up. Eat up, it will do you good. And the number one antioxidant food, well, it's not a food, it's actually a supplement that you produce, a hormone that you produce, is melatonin. Okay, now melatonin is sold in the stores, but you produce your own. You don't have to go buy it. People use it to sleep at night, but your body makes it. Your pineal gland makes melatonin. At nighttime, when you turn off all the lights, when you go to bed, your pineal gland makes melatonin, and you could sleep very well at night. Okay? You have to turn off your lights, get off this thing here. 2 hours before you go to bed, get off this thing. Okay? Turn off the TV, turn off the bright lights, 2 hours before bed, and relax. You could do a little bit of reading. You could read. It's okay, because it doesn't affect you when you read as much. And then when you go to sleep, turn all the lights off. Sleep in a dark room. And your body will be happy. You will produce melatonin. You will go to sleep. And melatonin is very, very, very powerful in preventing cancer. Now, blind women who are blind, they don't get breast cancer very much, like women who see. Do you know why? Because blind women are constantly in darkness. So they constantly produce melatonin. And also, because you have so much green, you have so many trees around you, and it's so green here, when the sun, the trees actually make melatonin from the sun. So when you walk outside, even there's something called near-infrared rays. Near-infrared rays actually penetrate your skull, they penetrate your clothes, and they get absorbed in the trees. So when you walk outside, even in the evening, you absorb it from the trees. And that also makes melatonin in the mitochondria. So we all have mitochondria in our cells. They are the workhouses of our cells, and you make melatonin when you live in a place like this. So go outside, enjoy the sun, get some sunshine, and walk out in the evening and absorb it from the trees as well. And that would also increase your melatonin level. And now I think it's our last slide here. So these are some other powerful cancer-fighting foods, okay? Like turmeric. How many of you eat turmeric? Okay, if you don't eat turmeric, start to eat turmeric. Turmeric is so powerful. They have done studies on turmeric. They have done studies on broccoli. And they have found out that the medications we use to treat breast cancer, like tamoxifen, for example, okay, when they compare that with broccoli and even turmeric, they find out that they are as effective as the medication without the side effects. Broccoli, eat your broccoli, eat your turmeric, because they're very good. You see it there, cruciferous vegetables like broccoli and kale and all that. Now, how do you prepare broccoli? How do you prepare broccoli? When you want to cook broccoli, you chop it up, and leave it for about half an hour, 40 minutes. Because the substances, the chemicals that actually give you the benefit, they are in two different compartments in the broccoli. But when you chop it up or you chew it, if you eat raw broccoli and you chew it, you get the same benefit. If you're going to cook it, chop it up and leave it for about 40 minutes so the chemicals would mix. That's what you see over there. Glucorophane is a sulforaphane precursor. The chemical you want is sulforaphane. But you have to get it from the glucorophane and from the myrosinase, which is the enzyme. When those two mix, then you get sulforaphane. But it only happens when you chew it or when you chop it up and leave it to sit for 40 minutes or so before you cook it. Okay, so you have to do that. And then the number one anti-cancer food is garlic. Garlic has been shown to destroy cancer cells more than any other food that has been studied. So eat your garlic, eat your garlic, eat your garlic. Put garlic in your smoothie. I put garlic in my smoothie. My wife thinks I'm crazy. But put garlic in your smoothie, chew it raw. It might sting a bit, but it's good for you. But the way you prepare garlic, you don't want to just eat put whole garlic in your food. You want to chop it up, okay, and let it sit also for a little bit, for about 15 minutes or so, because again, you want the alanine, okay, the alanine, which is the precursor, and the alinase, which is the enzyme. They are in two different compartments in the garlic. But when you chop it up and let it sit for a while, the two would mix and they form allicin. And allicin is what you want. Allicin is the fighter. It's the one that goes and kill the cancer cells. Okay? So if you cook your whole garlic, you cook it the whole form, it will destroy alinase, the enzyme, and therefore you will not be able to get the benefit. But once you chop it up and leave it and you get allicin, allicin is heat stable. So now you could cook it and you'll be just fine. Now if you buy ground garlic that's already ground in the store, it's already mixed, so you don't have to wait. You could cook it right away. Okay? So these are just some tips that you could use, simple tips. I know you don't have berries here, like strawberries and those type of things, but whatever fruits you have, whatever vegetables you have, eat up. Eat up. Okay? Because we all have, many times we are exposed to toxins and different things, and we can't get away from all these things because we live in a sinful world. But if you eat the right diet, at least by the grace of God, you could prevent cancer from developing. You may still have cancer. People still get cancer. But at least you have a higher chance of prevention. And prevention is better than cure. May God bless you.